joints. A joint basically is an area where two bones get together. So then the first type of joints that we have are the bony joints. In this case, you have two bones or three bones, and they get together, and then eventually they fuse and they form one bone. Example of this is the os coxae or the hip bone. This is the os coxae. This was one bone. This one is another bone, and this one is another bone. So then when we are developing inside the mons uterus, we have these three bones. Eventually, these three bones fuse, and you get only one bone. This is the ilium, ischium, and pubis. So that's what a bony joint is. This is another joint. In this case, the bones are connected with fibers. There are three main kinds. In this case, suture. Another kind is kyphosis and syndesmosis. The suture is connected with fibers, you can see here. Example of kyphosis is your teeth. They are joined to the bone, right, by these fibers. They don't move, right? These ones don't move either. They are not supposed to move. Right? And syndesmosis, this one has a lot of bit of movement, but you see here the connection between the two bones. This is the fibula and the tibia. So let's keep scrolling down. So let's take a look at the ones that we join with cartilage. This is the connection between the ribs and the sternum. That's cartilage. In between the vertebrae, there's another cartilage. And between the pubis, you have a cartilage. This is called the pubic symphysis. So the next topic is going to be synovial joints, which are the ones that move a lot. They are actually called diarthrosis. The joints that don't move, they are called synarthrosis. If they move just a little bit, amphiarthrosis. But in the case of synovial joints that move a lot, they are diarthrosis. If you connect two bones, and the problem is just to connect the bones, like you just get the cartilage and you join the bones together. But if you want to have a joint that is going to have flexibility and movement, then just putting them together with cartilage wouldn't be enough. So therefore, the synovial joints are more complex than just fibers or cartilage. It involves a set of different areas that are necessary in order to make this movable. But in general, you just have ligaments, capsule. Within the capsule, you have the fluid, and you have cartilage. In addition to that, you also have muscles and around this area. So if we keep scrolling down, joints and levers. Joints are considered levers. In a lever, you have three main pieces: the effort, fulcrum, and the resistance, right? Three pieces, okay? You have in here, obviously, the basic components, as I was telling you, effort, fulcrum, and resistance. The effort is usually the muscle, the fulcrum is the joint, and the resistance is whatever is that you're trying to lift. Why we talk about it? Because it gives you the mechanical advantage. Obviously, you produce a lot of times less force than what is necessary in order to move something. The classes of joints is because the bones have different shapes. What type of synovial joints we have? Ball and socket. You have examples in here. Pivot joint, saddle, hinge, plane joint, condylar joint. And what do you achieve with these joints? Different types of movements. So what type of movements we can have? Flexion, extension. What other type of movements? Abduction and adduction. Abduction is away from your body. Adduction is towards your body. You have also elevation, depression, movement of the foot, eversion, inversion. Diarthrosis are the synovial joints, the ones that move a lot. So let's scroll down and let's take a look at the knee joint. So we can look at that, and in there you can see what we mentioned for all the synovial joints. You have the ligaments, you have the bone, you have the cartilage right here, which is called meniscus. And obviously it's not in here, but this is covered with a capsule. And inside the capsule you have the fluid. Right here you have the cartilage called meniscus. You have the ligaments. That's the anterior cruciate ligament. You also have posterior cruciate ligament.